What is the best and the worst sweeteners for diabetic patients? Hi everyone, I'm AY the diabetes doctor. I'm a doctor and a specialist on diabetes. We'll continue our discussion on the various dietary advice for diabetic patients. Today, we are going to discuss sweeteners. So what is a sweetener? A sweetener is any substance that is edible and sweet. So there are various types of sweeteners. Before then, let me explain something. It is natural for someone to like sweet things because sweet things are generally motivating, comforting, and exciting. And we are created to enjoy and like sweet things because on our tongue, there are specialized cells that help us to taste things that are sweet. So there is nothing wrong in liking sweet things. However, for diabetic patients, there should be caution. So today we will discuss the various options that a diabetic patient can have. So there are also individuals that claim that they have sweet tooth, and actually that exists. It's due to certain genetics and also exposure to sweet things early in life. So if an individual as a child is exposed to sweet things early in life, eventually he has the likelihood of developing a sweet tooth. So for the sweeteners, they are generally classified into natural and artificial sweeteners. So for the natural sweeteners, we have the natural caloric sweeteners. The caloric there means it has the ability to generate energy. So you can also say natural sugar-containing sweeteners. So the natural sugar-containing sweeteners have the ability to elevate your blood glucose level after taking them. So when the blood glucose is elevated for a diabetic patient, there is likelihood that you will not have a good glycemic control. And if you do not have a good glycemic control, you are prone to complications. Such complications include problems with the eye, the kidney, the nerves, and other complications. So you can see that the natural sugar-containing sweeteners may not be suitable for an individual that is diabetic. Examples of the natural sugar-containing sweetener include your regular table sugar, your honey, the maple syrup, and date syrup. All these options are not suitable for a diabetic patient because we have seen several individuals bringing up date syrup saying that is suitable for diabetic patients. But the problem here is that it can easily elevate the blood glucose of a diabetic patient, and this will not allow that individual to have good glycemic control. The next example of sweeteners are the artificial non-caloric sweeteners. When you see artificial, it means that it is not naturally occurring. Diabetic patients are advised that anything that is not naturally occurring, they should avoid it as much as there is a natural or an organic alternative. Though there are no evidence that these artificial substances can cause cancers, heart problems, kidney problems, but generally speaking, artificial substances are unpredictable. And there has not been a very long duration of research to see the potential problem they can cause. So, it is my personal opinion that diabetic patients should avoid artificial non-caloric sweeteners. Examples of these artificial non-caloric sweeteners include the saccharin, the neotame, the aspartame, and the rest. These artificial sweeteners should be avoided by diabetic patients. The next class of sweeteners are the natural occurring non-caloric sweeteners. The natural occurring non-caloric sweeteners are the best for diabetic patients. Why? One, they are natural occurring. So they are not produced in the lab like the artificial, because naturally occurring are less likely to cause damage to an individual. Secondly, they are non-caloric. That means they do not contain sugars. That means their likelihood of elevating someone's blood glucose is very low. So you can take them without the fear that your blood glucose will be high. So it is my opinion, and based on several research, that the natural occurring non-caloric sweeteners are the best options for diabetic patients. They include stevia, monk fruit, and chicory root. These are the natural occurring non-caloric sweeteners which it is advisable for a diabetic patient to take. What are the side effects of sweeteners, especially the artificial non-caloric sweeteners? They can cause bloating. So an individual will feel bloated, like there is a lot of gas in his abdomen, right? So, and this is the commonest side effect of artificial sweeteners. Why do they cause bloating? They cause bloating because they supply food for the bacteria in the intestine. And if this bacteria digest what they give, the bacteria produces gas. So you see that your abdomen is increasing in size, and mainly due to gas. So that's why the artificial non-caloric sweeteners are not suitable for a diabetic patient. So in conclusion, it is normal for any diabetic patient to feel like taking sweet things because it's natural. And if you have sweet tooth and cannot do without things that are sweet, my advice is get the natural, non-caloric sweeteners like stevia.